Hello, everyone.
Hello, Kevin.
Hey, thanks for joining us tonight. We're going to give it another few minutes, for more people to get online that might be just finding us here. So hey, thanks everyone for joining us today. We have with us David Fidanza, who's the Chief Information Officer for iCoreConnect. iCoreConnect is our newest partner with the platform of iCoreRX. iCoreRX is a e-prescribe software program that will help us meet, first of all, the July 1 opioid mandate in Kansas, then also works, with all prescription medications. So you might want to move to that platform. So you're going to talk a little bit about that. But let me tell you how we're going to go today. We'll go ahead and have our discussion with David. If you want to have questions, we'll put that in the chat. I will tell you that we're doing this just as a meeting, not a webinar. So as you can see, everyone is open and available. You certainly can unmute yourself if you'd like to ask a question, if I miss you or something. But let's try to do a chat, or just say in the chat, I have a question or something like that, and I'll call on you, and we'll try to keep it under control a little bit that way. So let's go ahead and get started. With that, I'll introduce David Fidanza, who's going to talk to us about e-prescribing, the system, how it works, and how it can help improve your practice and your prescribing methods, as well as security. And he'll answer several of your questions. On the line with us today is also our newest staff member, Sandra Romero. I know many of you haven't had a chance to meet Sandra, so there's your opportunity to say hi to her. So with that, David, let's turn it over to you, and let's hear what you have to tell us today.
Well, yeah, thank you, Kevin. Appreciate the opportunity to speak to the group here. Just to give you a little bit about me, I've been in tech since the mid 80s, which, if you can think back, for those of us who were alive at that time, mid 80s, we weren't dealing with really just touching computing at that point. It wasn't really is involved in our life as it is today. It's certainly the difference is night and day. We were doing a lot of paper. You were working with paper charts, and if you were live, you remember what seemed to be simpler times. But certainly, over the years, I've held different positions. They're all in tech. I work with managing technicians and being a tech myself. Whether it be equipment right up through networking and personal computing and all that. And then over the last 15 to 20 years now, I've been working more on the software side of it, which in many of those cases had been with enterprise solutions. So, it's a single person right up through an enterprise, a corporate install or something like that. And really the whole idea behind tech and up through enterprise solutions is really try to take some of the manual process away to make things easier to work with. And it could be any number of other things to do with documents right up through scanning. And, everybody's really touching so much of tech these days. It's a necessary thing that we all do. So my background's there. I'm the CIO here. I run our managed IT services division, which is fairly large. And then also the software implementation team reports to me as well. So the folks that are installing and training and doing things like that, they report up through me. And I don't stay in the C-suite here. I actually am talking to folks like you every day. And I do a lot of Q&A because I really want to continue to learn about the things that challenge your industry and come up with ways to hopefully make that better. And so today is educational. We're going to focus on, hopefully when you're done with this course today, you'll have a better understanding of what our electronic prescription is, and then some of the real differences out there between solutions, and to help you hopefully make an informed decision here about what's best for your practice. So that's really going to be hopefully the takeaway you get today. Our title page is here. So we get a lot of questions regularly about features within the systems, and we want to make sure that you understand what those are so that you can determine again what might be best for your practice. As I said, we actually focus heavily with our software in dentistry The majority of our business is dentistry, although because we have managed IT services, we deal with all business, but we also do a lot of medical. So dentistry is by far number one. And we're a cloud-based company. So, you know, if you know what that means, it's computing that you use a web browser to access. And you're doing it today if you have a Gmail account and you're cloud computing. And then a lot of other people have moved to other solutions that are working on the web. And, you know, the benefits are great there. You know, there's so many, which a lot of them have to do with technology and cost. If you look at our history here, 2014 is really where we started working with solutions. We actually came out of the gate in 2014 with a HIPAA compliant email, and then went to Texas and talked to them about, you know, what their needs were. They helped us actually design the final product that we delivered, and we got an endorsement there. And if you look, you know, we've had a lot of success going through the state association channel. We find we're a good, we have a lot to offer, and we're a good partner. So that's why you see the momentum you're seeing here. And if you, Kansas was, you know, what was it just the other day, and you can see there's actually one after that. So we continue to get awarded a lot of these type of contracts, and we're very thankful for that. You know, so when we look in Kansas, you know, a little bit of background here. Kansas, like many states, are passing laws for e-prescribing, and they're different across the spectrum. Some of them, like New York, they went full electronic prescription for everything in 2016. And more recently, just October 1st of this year, to give you an example, Michigan said if you're going to send a prescription to a pharmacy, it has to be electronic, no matter what it is. Now, other states like Kansas say if it's a controlled substance or an opioid, you know, so there's different states are doing different things. This House Bill 2119 is lengthy. I invite you to read it. In there, right at the top line, I pretty much think is where this lands. And it's every prescription order issued for controlled substance, schedules 2 through 5, that contains an opiate to be transmitted electronically. That takes effect, well, it did back in July. Now, with all federal, state, and local law, there is a lot of fine print. We're not going to be focusing on fine print here because we feel that, first of all, this is sweeping the nation. They're starting it in Kansas this way. The likelihood that you move to fully prescription at some point in the future is high. So it's a good idea to really start getting educated about it so that you can make these good decisions. Now, if you look at just e-prescribe in general across the United States, you know, it's on the rise. I mean, every year looks like this. If we went back, e-prescription, for those who don't know, really started right around 2018, 2019, and with the, I think of Obamacare was started percolating up, and that's really where it all began. But it was really mostly within hospitals and health units and things like that, where you know, they had the wherewithal to do it. It was important for many reasons to have that capability, and they had the money, right? And there wasn't many choices out there. So if you're in a hospital, you're running, you know, a very expensive electronic medical record. They want integration. They have the money to do it, so they can get that all done. Well, if you're a private practice, you know, has not always been the case. So there had been a lot of barriers over time to why people were not e-prescribing, but they've mostly been removed. And so for example, you know, it was just really expensive years ago, where today that's not the case. And then right up through, you know, they didn't need to, right? So for many years, you know, you might find the physicians are e-prescribing, but when it came to dentists, not so much, because there was really never a need to do that. Okay, and you know, paperwork fine, or the way you were doing it, it was just fine, and you know, you were comfortable with it. So, but as things change and mandates come in, you'll start seeing this climb even more. California is right behind you here, by the way. So that's going to be a big number there, because they're the largest state association in the country. Now, so you can see the growth of this here. You know, questions come up all the time. What is e-prescribing? And, you know, that's a good question, actually, because, you know, if you think about it, you know, talking, we're right now speaking over, what is the internet, but it's actually electronic transfer. So, technically, e-prescribing doesn't mean just anything. There's a specific definition of that. And it really is doctors that are using specialized software on their computer and that could be, laptops and other devices, but to write in accurate prescriptions and send them to the pharmacy directly. As you see on the next slide here, that doesn't include faxing, which is electronic, but it's not, would not qualify as e-prescribing under the law. Emailing, you think it's electronic transfer, not e-prescribing, telephone, calling in and writing scripts. These are all going away. So they don't qualify for that. So what does? It really becomes a specialized highway that you get on where you're privately communicating with networks and it's not exposed to the public internet. Now, why, right? So there's always a bunch of reasons of why things change. And sometimes, we look at what the initial thoughts were of why we should do this and all those good, meaningful things that you want to put in place. But there really are measurable benefits to e-prescribing. And so when you see these laws, a lot of people come to us and they want to see a demo or they want to talk about the product. And the first thing they really have is a negative view of it. And it usually comes with another mandate that's going to cost me more money. So once we get kind of through that conversation a little bit and show them really what e-prescribing actually is outside of just a mandate and a cost, usually the attitude changes a little bit. And hopefully you'll learn some things here that can come with e-prescribing that you might find valuable or of value. Now, if you think of better clinical workflow, I mean, is that maybe the most overused term in medicine? Because everything's supposed to bring you that, but there are things that do that. And one of the things is when you're going through your everyday processes, having kind of a workflow that you just follow every time is useful. And because you get used to it and you know how to do it and you get good at it and it becomes quicker and easier and all that other good stuff. So, at the end of the day, really writing a prescription and sending it out is, you know how to do that, right? So if you know how to do that electronically, you'll find that it actually speeds things up, and then it can help you save time to focus on maybe things that you really want to focus on, like, for example, security things or patient safety and things of that nature. So, one of the things that we always say about doctors is your handwriting's terrible and nobody can read it. And I think there's a course in medical school for that, but it turns out that actually that becomes a problem at the pharmacy. And, I think what you find out is that they can't read your writing. They call you up. They don't guess what you intended to write, but it slows things down. So when you're dealing with electronic prescribing, that problem goes away. One of the things that, if you think of, like, you go to your favorite diner or something and, maybe it's more like years past because now they're holding a tablet in their hand making the order. But remember in the old days in the diner, they'd slide that order back to the cook and they take the ticket down, they line it up. Well, pharmacists work like that too. So, you send a patient in with a written prescription, it gets added to the pile and they'll get to it, next in line or whatever the case may be. And so that kind of workflow is similar. Well, ePrescribe works the same way, but now it's digital. So it's like the next email, kind of, if you think of it that way. You're going to fill the next order that comes in. Now they have specialized pharmacy software and it just queues it up and they'll fill it when it comes in next. And they'll be able to read it because it's electronic versus written. Now, imagine there's a lot of conveniences that you can bring for the provider. And I know most folks that might be on this call are practicing dentists. So, you say, how could it be any easier? In some cases, maybe call it in or something like that, but it can be. And because with the right setups and things, you can get it out quicker without, really interfacing with anyone else or, and in some cases, from remote locations where you didn't have that capability today. So the patient as well, where you can have it at the pharmacy, like if they're in your office and you send it, hopefully it's ready when they walk into the pharmacy and they don't have to do what I always do, which is walk in, hand them the prescription, shop, and then walk out with stuff that I probably didn't need, but I bought because I was in the pharmacy. And the pharmacy's like that, but at the end of the day, a lot of us are more pressed for time, and anything that they can save, picking it up, and if it's ready when you get there, adherence comes into play and things like that as well. So overall, there are benefits here, and you'll see them as you step into ePrescribe and what that means. What is it in a nutshell? It's really, help improve healthcare quality and safety. The medication errors go down. There's no question of what you're prescribing. The drug is clearly written there, and the quantity in your SIG is all clear. And nobody's not going to go get it filled because they don't have the time. If they can go pick it up and it's ready, it'll definitely save them some time, and it can be quicker for your practice. So that's really the nutshell. Now, here is one of those doctors that came on, and I interfaced with him in the beginning, and thought coming into it that it would be kind of just a hassle. And what wound up happening was they got on it, they got trained, and now the staff is just speeding through it. So it becomes more productive. They're doing all of their prescriptions that way. This gentleman here is the North Carolina Dental Society president, current. So we were happy to hear that from him, because we like to put that in our presentations. So we want to, as I said, this is educational. We want you to walk away with more knowledge than you had when you came into it, and hopefully you learned something here today. So what we're really going to talk about is, things that we hear all the time. They're in no real order, not like David Letterman, the top 10 and, the number 1 and all that stuff. But just to take you through this, we want to run through what we hear all the time. Now, we're all shoppers, we're all consumers, right? And we go about things in different ways. I think my wife just buys whatever's in front of her at the time, and it's usually will add up to exactly what money she has in the bank. And she says the same thing about me from time to time, but I remind her that I like checklists, and because I like to do comparative shopping. And, you'll find some people, that's kind of the spectrum of how people shop. And however, I think it's a good idea to really start from a spot like this, because number one, if you've not been in ePrescribe and you don't really know much about it, sometimes things can slip past you. So that if you have something that'll help you remember so that you can, when you're looking and comparing on things, that'll bring you back to, hey, well, why did I check that box, and is that important to me? So that's a suggestion. We approach things in our company here with a nice must-have or nice to have when we're looking at deciding on maybe a new software platform that we're using internally or things like that. And then that helps us shop. So we'll go kind of through that and wrap that up toward the end so you get a good idea of what we're talking about. So one of the things that people talk about or ask about all the time is, will this connect to my practice management software? And there's usually followed up with a question is, and what does that really mean, right? So that's a big question, or a couple of questions there, because it can vary. When you talk about practice management integration, so this is, your Dentrix, your EagleSoft, your Open Dentals, your Soft Dents, and all the other ones that are out there, right? So if you have an integrated solution, it usually means that you don't have to type in patient demographics. So let's think about that for a minute. Patient demographics, what does that mean? Well, we know name, address, right? Phone number, date of birth, and gender. So you have to have that if you're going to prescribe electronically. And then on top of that, if the patient is a minor, then you're looking at it like a date of birth and I think weight as well. So, that data, without having to type that a second time, is nice if you have it integrated. Ready? I mean, who wants to dual entry anything anymore, right? So integration means you don't have to go in and enter it into a second system. So that certainly can be helpful. And that will then improve workflow because, not having to type that in. That's just a major waste of time. And, you know, hey, we're all error prone, especially typing anymore. You know, we're speaking in shortcuts now. You know, who types the word you anymore, right? Well, especially texting. So we actually saw an email come in and somebody today, and it says you are invited or something. They use the letter U. So we knew that person was probably younger and used to texting. And also integrated solutions are available on many, but not all systems that are out there. There's some older systems out there, they're just shut down and they're not really doing a lot of new integrations, or maybe they never wrote really the technical write-up that's required for integration. So, you know, it varies. Now, access, what computers or devices can be used and where? Again, the answers to this are all over the map. If it's cloud-based, meaning you're using your internet browser, generally that means you can access that from anywhere. If you're on the web, you can access it. The major reason people want cloud computing. Often you could use any device. It doesn't have to be a computer. It could be a tablet. It could be a phone, and you know, all the other internet type connected devices. Now, when you're working on the web, one of the great benefits of that is backup goes away. The data is being backed up automatically. Now, there's, you know, subchapters to backup there, but you know, the idea is your data is pretty safe there as far as backup. Now, some of them go to extra lengths to backup. So, for example, there's a thing called CDR, continuous data replication, and what that means, you're typing, it's backing you up. So it's continually doing that, and it's supposed to back me up at 6 o'clock tonight every night. So there's different types of backup, but cloud is going to give you the best one. Many do automatic software updates. So, you know, generally I would say 99.something%, because, you know, again, major benefit of cloud computing is updating software without you having to be involved. And, you know, then you get 24/7 access as well. So many benefits to cloud-based, but, you know, sometimes you have to deal with server-based systems for different reasons, or you might select one. Usually what that means is you're going to be in your office. Now, think of this, you know, we've all just went through the last 18 months or so, and you all figured out, you know, how technically challenged we were trying to work remote. And are you working from home? Like, can you just dial in or be connected straight into your server and work with your practice management software? If that's the case, then you may be able to do that from your home or other locations where you might have had that configured. Now, you might have learned that, you know, that takes a little bit of technical skill to get that connected, and you might have invited had your IT people in helping with that. Usually what that means is you can't be at your neighbor's house doing that, right? Whereas if it were cloud, you could. So, you know, there's a lot of different subcategories here, but, you know, a lot of times when you're working with server-based software and server-based, say, ePrescribe, that usually can mean that you're within that software and there's some launching point from there. So for example, you're in the patient's chart, you push a button to prescribe, and it might do the demographic handoff for you. But that doesn't always mean even that level of integration means it's fully integrated. So let's say, for example, you might be able to send a prescription out and it loaded up the patient's chart, but or demographics, but that doesn't mean that the prescription that you just wrote went back into the medication history where you're used to looking at it. So that varies there as well. And, you know, these are the kind of things that if when you're going through the process of considering what's right for you, you want to ask those questions, right? You say you're integrated, what does that mean? Okay, and then get a little bit more detail on that. Now, because it's your server, it's your software, you're back to dealing with data backing up and things that you're probably doing already. You understand the time, the tech challenge, the cost, and those things. And the question I would ask is, have you ever lost data and try to recover from that backup? Because sometimes that can be a surprise too when you find out it's not a good file for whatever reason. So there's a lot of different things about on-prem. We call it on-premise computing. And, you know, when you talk about updating that, you know, we've went from, if you remember, you know, using updates that were sent to us in the mail on a CD. You know, you went through other methods of updating your computers and your software, and now you might download files from the web and it has some kind of wizard that loads it. But that's all changed over time, but it still requires some some work on your part. Now, there's apps out there. Everybody like apps. Who doesn't like apps, right? Usually when you're dealing with apps in ePrescribe, that means that one phone. Okay, so it's because the phone is registered to you as a prescriber. And so what does that mean in your office? If you're using the app and it's on you as the prescriber's phone, that means you're the one that has to basically electronically set this up or get the patient data in there, and then also the one to release it. And you're used to having an assistant doing that. So apps don't let you do that kind of stuff in many cases. So those are the questions you want to ask there. As I say here, most require that you enter patient's full demographics. Imagine being on your phone typing your patient's home address. Okay, so and name, address, phone number, date of birth, gender, all that stuff.
There you go.
Many apps do not keep patient lists. So you type in patient's name, all the demographics, and many have limited or no ability to save prescription templates. So you're probably using templates now. They're handy. You don't want to keep typing them up. Every time you do that, you might bring more, errors into that prescription. And so, one of the things I think of, when people use phones and go back to abbreviations, I didn't stay up with all the latest ones, so I always use like LOL, but we know what they are. And, everybody speaks like this now. You're in shorthand and emoji speak. And so what that means is that's no good for ePrescribe. So you got to kind of get back to the normal way that we used to really type. So, weigh that out, when you're looking at those things and ask those questions. On to the next one here. You've seen the prescription monitoring site. Every state pretty much has one. And the idea here is to, why the whys were, well, first of all, if you don't write controlled substances prescription, you've probably never went to these sites. In some states, it's mandated from pill 1. All right. So if you're going to dispense a single tablet or capsule, you need to check that history. If the question becomes, do you go to Ktracks, and do you go there often? Now, a lot of times, pediatrics obviously would have limited or no reason to go there. Ortho doesn't do a lot of that. But if you're in surgery or some of the others that cause that pain, you may be working with opioids, and that's a good reason to do that. And when we say, why did they put all these together? We got an opioid crisis here, and you know what? I'll be the first to tell you, it's not your fault. You happen to be a doctor, you prescribe opioids, but people make choices. However, what happens is that people might call you and say, I have pain, can you look at it? And they tell you they're in a lot of pain, and dentists will write a prescription for a certain period of time, but they're shopping just to get a few more pills for whatever length of time. I think the last report that I had seen, there was 100,000 overdoses in the country. I think it was right up and through March of this year. And if you looked in history, not even a decade ago, this was less than 30, 40,000, which is a crisis. That's a lot of people. And if you think of people probably you might know or family members that have went through addiction and how terrible it is and how destructive it is to families. So, the good intention here is let's give doctors resources so they can make more informed decision. But then, what happened was it's outside the clinical workflow. All right. So number one reason doctors do not check these sites, and even though that they wanted to, it's because it's just outside the workflow. And you wind up having to go somewhere else. It takes a lot of time. And so these kind of things, mean less time to spend with your patients or business. So, however, imagine the idea was built because it gives you a snapshot into not just what you may have prescribed this patient, but all doctors. And it includes all sedatives, stimulants, and narcotics. So in there, that's the triple whammy. And if you see a patient that's loaded up on a lot of these things, you might, make a different decision of what to prescribe that day. And that was really the idea behind that. And as I said, like in Texas, you have to look at pill 1, You have to look at that site. That's a mandate. They won't even dispense it if it's not known that you check that. So consider that. So if you look at Ktracks, here, the two orange circles there, that's you in the pharmacy. Ktracks is in the middle there. And so where that's all that data is. Now, insurance programs might have access to that, healthcare insurance benefits. The state health departments are getting data from there. Now, this is, and a lot of them are using, what do they call it, de-identified patient data. They're looking at trends and things like that. Give you an example. New York reports that since 2016, just by enacting electronic prescribe and the requirement of opioids, what happened there was they saw like a 30-something% decrease in the amount of opioids prescribed. And there wasn't even a mandate that said you couldn't do it or you had to check this. What it did is just it mandated that you send a prescription electronically. Opioid prescriptions went down 30%. Okay. So states have taken a number of steps to make this easier to access. And one of them is to allow for access to this site. If you've went to Ktracks, you go to a website, you log in, you enter patient data, and you retrieve a report. That's 5 minutes at best. All right. So what happens is that, again, number one reason that doctors report they don't frequent that site as often is it's outside the point of care. So what they did is they allow for integration into some of these systems, and that gives you access to that within a few seconds at the point of care where you're prescribing. So that's a real positive. This integration eliminates some of those hurdles here. And as I said, if you could get that report in 1 to 3 seconds, would you do it? And most people might say yes when they're working with these scheduled meds. And it instantly shows you the patient's prescription history of controlled substances from all doctors and includes all the schedules. So that can be a real positive thing to know right at that moment. And you don't have to type patient information because it's coming right out of your practice management software. So certainly integration is good there. Now, there's other features out there, automated medication history for reconciliation. And some people ask, how's that different from PDMP? And by the way, PDMP is Prescription Drug Monitoring Program, so Ktrack. Well, there's actually this terrific tool out there that's really starting to work well. When pharmacists dispense meds, they're basically on a national backbone, and which is beautiful because we can tie in, we're tied in, or companies are tied into that backbone. And what happens is they can draw information out of that. And so you call it an automated drug fill history. So now what the difference between that and what Ktrack does is it's not just controlled substance, it'll show all meds, all doctors. So that's very helpful. And because you're dealing with that all the time, it's medication reconciliation that you're doing to your patient. And some of those difficult cases that you have where patients might have quite a few meds, certainly getting that accurate information out of the pharmacy network can be a real benefit for you. And so what it goes through just to even just enter that into your practice management software. So having that accurate information come in automatically, so many benefits for that. All right, so how many of you still use a desk reference that's paper, right? So, that's the way it used to be. More and more people are moving to different types of physician desk references and how do they kind of work with ePrescribe? Remember, we want to kind of stay in that workflow, right? If you have to leave where you are to go to the book, that might be, you're in the operatory, book's in your office, it's out of the workflow, got to walk into my office. So if you have any integration into these, they're certainly beneficial. And, we get a lot of positive feedback from doctors when they understand that those features are available today. This gives you instant access into electronic clinical decision support. And, you're looking now at a comprehensive, like PDR, right? As you're used to it being as comprehensive as they are. And, one of the difference between like these online guides versus say the desk references you don't have to keep it updated because they do. And so, when you log in tomorrow, if there was an update yesterday, you would see it. So it kind of keeps you up to date. And I call it the drug of the week. Every night when you watch a commercial, hey, this new drug is out. Well, that's in the book. So there's all positive things. And, one of the things that, when I talk to dentists, they say, well, we use like a handful of meds, 5. Well, you probably know everything in the world about them. But what it is what is that med that they're taking? I don't recognize it, right? Is there contraindications here and all the other things? And the having access to these guides and tools instantly is certainly very helpful in those cases. Now, I was mentioning templates earlier when we were talking about apps. Templates, I barely talk to anyone that says they don't use templates. You use templates in anything, many things. You might have them not only for, say, prescriptions, but then maybe your clinical notes and others, maybe letters to patients and so forth. So why would you use a template? Well, speed and accuracy, right? It's going to speed up the process of whatever you're doing, and it's going to ensure that the accuracy of the content remains high. Because you don't have to retype all those things over and over. So, I had seen somewhere that, there's people that have human error rates in typing. They track that, right? And they're anywhere from like a good data entry people make mistakes in the, 3-4% range. But some of us, if you have children, what, you're dealing with 20%. So templates are helpful. They speed up the process. They ensure accuracy by eliminating typos and errors. And, one of the things about some of the tools that you can get in some of the systems out there is if you have a multi-doctor practice, you can build one template or set of templates, and you can, in some cases, share them with others. And each can kind of personalize from there. But, we've seen practices that have, 10 doctors. So nobody wants to build 10 sets. So you start with one, share it, let people kind of do other things like that. So look for those kind of features. They certainly are very helpful. Obviously, security is on everyone's mind. I had read an article just the other day. Ransomware, which is a real threat, is up 300%. I'm sorry, 200%. January to June of 2021. We matched last year's ransomware attacks worldwide. There have been 300 million. And, anytime you're on the web, you're thinking security, or you might be thinking security. It's on my mind, certainly. There are a lot of reasons to be aware of what's going on and how that might affect you. And it's important that, you either are in deep in that, or you're working with people that can help you with this to make sure. Now, I can tell you, with ePrescribe, there are security protocols in place. So, you keep your server or your access to your patient databases secure. When you're working in this network here, it's secure, all right? And there's BAAs to protect you as well. But however, people still need to talk about or understand, what does that mean? It's definitely more secure than paper. Have you ever heard of somebody, making or grabbing a copy of a prescription pad, or, and forging a doctor's name or changing the quantity? There's all kinds of things. We've heard of, people using like chemicals to erase the quantity of the fill or something like that, or just straight out forgery. Well, to come into ePrescribing, you got to go through credentialing. And so you got to go through identity proofing. There's, when you're dealing with controlled substances, there are multi-factor authentication. You might have seen the way those work, working with banks. It could be a credit card company, to text, you might have restrictions on your kids or something to get a notice to release something if they wanted to buy something to a higher dollar value than you've allotted them, things like that. And so there's multi-factor authentication. You don't have to buy prescription pads. So, while that might not, break the bank, there's a cost to it. And, anytime that you're dealing with ePrescribe, this is outside the public internet. So, people have varying understanding of how the internet works, but think of it as there's this big highway out there and data is traveling on it. And I can tell you, I've seen webinars and other security things that they show you how people intercept communication on the internet, and it'll blow your mind. And so they go through encryption, all these different things to stop that. So even if they can intercept it, they can't read it. Good thing. Encryption is definitely good. So, but the criminals always seem to be one step ahead, right? And of course, if you go to movies, if you enjoy newer movies, they got you scared to death about it. Now, security on the internet is real, or security awareness. You need to be aware. And so those things come with a whole nother thing that's kind of like, HIPAA compliance and security audits and risk assessments and stuff like that, but take it serious, it's real. But when you're working within the pharmacy network and doing ePrescribe, you can be fairly certain that you are secure there, and the network's secure, the software is, and the tunnel that you're working on is secured. Hey, onboarding. Onboarding comes in a lot of different flavors. When I've seen a lot of different ones, and we do have a product, so we know what we do for onboarding. So what I do is I go out there and look at how other people do it, because I want to understand how to make ours better. But in any case, there's certainly a lot of reputable companies out there, and they do things well. And I'm not here to say anything bad about it, but let's just put it this way: there's a difference. And some of them, if you think about what does it mean in general, there's really three parts to it. You got to collect information to set up the account and who's going to use it. And then secondly, if you're dealing with any kind of technical work, which you will be, whether it be cloud, on-prem, or app, there's some sort of tech happening. And then there is credentialing. So we do the identity proofing and things like that, and two-factor authentication, set all those kind of things up. But that's really the three pieces of it. Now, how people approach that is different. For example, can you get help? Like the idea here is if you're looking at different products, ask these questions, right? So what does your onboarding look like? And can we get help? Right? The good question to ask. Sometimes is going to be the answer, depending on who you're talking to. Some of them are, well, first of all, this is a complex process. And if you were to see some of the onboarding guides that are out there, you'd know why. And so most people really just don't have the time to sink into 30 or 40 pages on how to do this. It's a lot like reading tax documents and instructions. So if you enjoy that, take a look at these. Most people don't. They more like the TurboTax way to do things, and where it's kind of interfacing, kind of walking you through it. And more, that's the way things go. But it varies. And so, when sometimes it might not cost you anything, and other times it might cost you up to $300. So that's certainly a consideration, and you want to know that before making final decisions. And what happens after? Okay, I just changed out a computer or a phone, or I got a new employee and they need some training or help desk. Something's not working. What happens? And you want to know what that is before you make final decisions, so you understand. So you get into fees, and again, these are kind of all over the map. One of the things you go is, how much does yours cost? And it's funny because a lot of times that question comes up first. And when I demo for people, I don't give out pricing because I don't even know it. I do demos in that role, and we have trained demonstrators that take you through the process, but we don't go through that. Your account managers will ask those questions, so you should ask those questions. Now, they are all over the map here, but know this, that every doctor will need at least a subscription to ePrescribe. If you have 2 DEA numbers, it's likely you're going to need 2. We find people on the state lines that wind up, having a DEA number in each state and different things like that. So there could be cases like that. You're one person, but you need 2 licenses. But then pricing structure from there kind of varies based on your vendor, and maybe even their tech and things like that. So for example, let's say you have a practice, you're in the same state, you're in Kansas, one is running Dentrix, one is running EagleSoft, you need 2 prescriptions, or subscriptions, I should say. If you're looking for, say, because if you want an integrated Dentrix one, that's a subscription through Dentrix. Let's say if you have EagleSoft over there, subscription over there too. There's other ones that can that could be one subscription. So again, ask these questions and find out after explaining the way your practice is set up, because they should be able to answer those questions up front, and you should know those answers. Now, some practice or e-prescribing software, you want somebody to assist you to stage meds and set up patient files, that's an extra subscription. All right, so you want to ask, is there another subscription required for assistance? So then you get into what is the cost of the e-prescribing stuff out there. Well, the highest number I've ever seen is $200. That's per prescriber per month or provider. So providers, by the way, are prescribers. So it's not your hygienist and folks. But let's say, for example, up to $200 for a subscription, you might at that point consider options, right? Do you want that integration into Ktracks? That's going to be, if they can even do it, that's probably going to have some additional costs involved. Maybe you're pediatric and you do not do controlled substances, you don't need to add a rider for that. If you do write any controlled substances or you want to in e-prescription, there's a rider. It's an uplift from the base cost, but it's available to you to add as an option as needed. And then find out what your onboarding and support is after that. Now, again, does advertising work? Well, I think it does. I think most of us could agree it is. I think this is one of the greatest corporate lines I've heard, because it seems to me that whether or not, afterward, that Cy Sims here really meant this at the end. I really believe this was the thought about it in the beginning, because if you're going to go and buy $1,000 suit, you're going to want to know why, and they're going to tell you about the difference between the care, the stitching, the material, and all the other things. An educated consumer within e-prescribing is going to make a better decision here. Think of this. Now, usually if I'm in front of a group, I might say, raise your hand. Who owns a timeshare here? Right? Now, I would say to, you see a couple hands go up and you say to them, would you buy that same timeshare today, knowing now what you know after you bought it? And, okay, I don't want to kick timeshares because I know people do like them, but, really what happens is that people get into products for one reason or another. And then they find out later, now that they know more, maybe they would have made a different decision. So let's go back to where I started, which is a checklist. Make a checklist. What's important to your practice? When I bought my first home, we made a checklist. I wanted a cul-de-sac, good schools, 3-bedroom, 2-bath, right? That was kind of, well, the must-have was good schools and a 3-bedroom, 2-bath. But a nice to have was, hey, a pool, must have might have been, whatever else you're looking for in a home. Nice to have could be, what part of town or close to the water or lakefront or something like that. So, those are the type of things that you want to do here, because just because you might not be able to get everything that you want, you might be willing to go without because it's nice to have, but we can't get it, but I do like this for whatever other reason. So I would encourage you to make up those type of checklists to help you wade through this decision here. And I've listed the ones that we did review here for those that maybe want to do a screen capture or something like that. And I think you might be able to get some feedback here after. But I'm going to end this on that note because we want to open it up to any questions. And I think a few chat questions came in. That was the end of the presentation. And I guess there was one thing here, in case there are questions. As an endorsed vendor, we do, there's an automatic discount for you. So if you go with our product, you get automated discount and you can see the pricing up. And we do have that integration into Ktracks. All right, so that now is the end of of the presentation, I'd like to take questions now.
Hey, David, we did have a question about integration. I think that was the first, I think that was number one thing you had up. And you talked about EagleSoft and some of the other dental software products. Specifically about iCoreRX, does it integrate with, say, EagleSoft, or what does iCoreRX integrate with?
Well, thank you for the question. What we did is with iCoreRX, we did a little different. For example, like if you went to EagleSoft and you said, I would like your prescription services, they have one, and you can get it through them. And however, it's a third party and it doesn't check all boxes. So, and integration does mean different things to different people. So, we do have integrations through, we call it the big three, and coming soon, the big four, which we should cover about 80% of the market. What that helps you with is you don't have to type patient data. You also get a schedule shows up so that you're not hunting for patients, and then so the integration mostly means that, all right, your control records within there. So like, for example, some of the other guys say, well, we're integrated, and if you buy our solution that we have through our company, it integrates, but it doesn't push the medication history back into the chart. So there's, again, find out what everybody wants it to push back in, all right? There's reasons that it can't always do that. And in fact, I couldn't even tell you one that's completely fully integrated. So, you got to find out, what does integration mean, and what does that mean for you, and is it must have, nice to have? Oh, I'm sorry. Kevin, you're muted.
Yeah. So I guess I got a follow-up question on that. So so with EagleSoft, is it yes or no, or partially, or, I mean, I guess, again, I guess just trying to get a sense
Yeah.
of.
So with EagleSoft, we are integrated. We get the patient demographics, full demographics, patient schedule. So when you open it up, you're on today's schedule. So you can just click the patient that you're seeing today. What we do not do within EagleSoft is push anything back into it.
I see. Okay.
So the way people treat that is, and this is kind of the way, I hear people do it, and this is the way I would suggest you do it. You treat it as a call-in. Everything that's electronically prescribed, you treat it as if you called it in, which means you call it in, go to EagleSoft, push your template. That adds it to the patient's chart. And there's reports and stuff that help you do that as well.
We have another question about, does it push information then into the chart?
Yeah, that's really the big thing there. And a lot of the cases is you have a data mismatch. You have to have data conform on both sides for a lot of that to work. And that's really the biggest challenge to that. So we don't push anything back into EagleSoft at this time. Now, that's not
this is a question about charting. So I assume it's a question regarding electronic health record. If you're using ePrescribe, can you push that back into your electronic charting? But I guess same thing with soft, I guess it'd be anybody, right?
Yeah, and I think you're going to find that's a very, very rare breed. Nobody is really doing that right now, and because of the complexity of the data mismatching mostly. But we're not saying that's not going to ever happen, but right now we don't, and few do.
David, I think this is really a follow-up question with regard to the discussion on integration with EagleSoft. Question then was asking then about Dentrix. Is that the same sort of what you described EagleSoft, is how Dentrix works as well?
That's right. That's right. Now we're actually development partners with these folks too, so that as things change technically and we can get more kind of capability within that, we've pledged that we'll increase whatever level of functionality that we can possibly do within the system as that becomes available. So even though, sometimes you get out of the gate, but something changes later as things improve.
Okay. Does anyone else have any questions? Those are the only the ones I've asked, are the ones that were in the queue in the chat box.
Yeah.
Hey, I have a question. Can you hear me?
Yeah, you bet.
So my question is, you were talking about, so you have some programs that allow you to see all of a patient's prescription history, not just controlled substances, but their whole gamut of prescriptions.
That's right.
So with iCoreRX, like, one, do you have that capability? And two, there are a lot of patients that come in when you have them fill out their medical history and they're like, oh, well, I didn't bring my bag of prescriptions in. I don't really know what it is. So then if you were part of iCoreRX, could you literally go into the system or programming and then have a complete list of all the medications that this new patient is on that they don't remember everything that they have taken or currently on?
Yeah, so to answer your question, yes, we do have that feature, and yes, that's the way it would work. And even
Okay.
if it's the first time patient, you've never seen him before, you plug in the demographics, and that's just transfer into the system. It will pull back that history. That's a comes with, so that's not even an option. It just works that way.
Okay. And then my next question for that is, if this is becoming more of like the mainstream or regular thing with that, is it still going to be a requirement on medical histories that you even ask that question of patients when you have access, once you know like their name, their date of birth? Like, is it imperative that the patient themselves like try
Yeah.
to tell you what prescriptions they are on if you
Yeah.
can get access to it?
Yes, and this is the idea. Everything as well intended as it is, you still need to use clinical judgment here. You could have a patient mismatch. They could have asked for privacy, and different states have different privacy laws. So you want to continue on doing your med rec, but the difference is if they're reporting and they say, they report say 9 and they say, and one more, I don't know what it is. What you might be able to do there is look at your report that you're getting back from the national list and say, oh, what that is Narvasec or whatever, and then help them. But certainly clinical judgment is still required there.
Okay. And then I guess another question is, to me, this electronic prescribing is relatively new, which I think in the state of Kansas before July, I mean, it kind of hit a lot of people, I think, square between the eyeballs. But like, what is your competition, or how do you know a reputable company when, to me, this all seems quite new? It may not be new in the computer tech sense, but from me as a dentist perspective, I mean, I don't know any potential competitors. I don't know what I'm looking for as far as, what makes one better
Sure.
than another.
Yeah, I mean, those are good questions. And, one of the best answers I can give you is your Kansas State Dental Association did that, and they went out and looked amongst all the competition. And so they're a good resource for you. So number one, not everybody's going to follow there. That's good that they did it, and they did their due diligence and selected vendors after, a review of many. And however, they, generally speaking, you have a software that you're using. A lot of people go to the vendor and see what they offer, and then go back to your checklist and say, what do I like? What do I need? What do I wish I had? And then, match it up and figure it all out. And usually a little bit of research on those type of things, it can kind of present you with others. If you were talking on, if this were a sales call, that would be different. I can tell you, 10 reasons to go with us, but, certainly we want you to be educated so that, you feel confident in when you are making decision that you were informed.
Mm-hmm.
Thank you. Hey, Mark Herzog, do you have a question? Looks like you've unmuted yourself.
Yeah. So here's my flow. I did my surgery. I take my gloves off. I turn around. I hit the Eagle Soft prescription note. I find my template. I hit it. I print it out. I'm done in 30 seconds. What's my work schedule going to look like with this?
Do you know before the surgery what you're going to go post-surgery?
Most generally, yes.
Okay, so that could already be staged for you, and it's controlled substances, I'm thinking.
You're right.
Okay, so you're going to have 3 clicks to get it out the door. You're going to have to do a 2-factor authentication. So it might take you less than a minute.
Okay.
So
So
what you can do is you could stage that well in advance of the visit. If you know what you're going to do, you could have your staff set it up for you. The pharmacy set up, the meds are set up, and until the care is complete and you're going forward with it, you log in, and within a minute it's out the door.
So one thing we're going to have to start asking, or at least put in our software, is where do you want this prescription sent to?
Right.
So then you're asking, okay, is this still where you want? Oh, I'm going to Salina today. Can you send it to Walgreens instead?
Right.
What's that going to look like?
Yeah, well, so if you know that beforehand, your staff will have that staged for you. And if you're at the point of sending it and they change that, do you know what town they're in? If it's in your area, it's gonna be on your list. You could just click it.
Okay.
Yeah,
So
I was
they
gonna say,
could
Dave,
say,
all the pharmacies are already for your area will already be in the list. So it's a
That's
good
right.
drop down screen that you'll click on. Is that correct?
That is right. It's a learning system as well. And
Yeah.
in some of them, I'm talking specifically about ours. Once you start prescribing the population, your local pharmacy list comes up. You can add any ones you like, but you're really not adding them to the National Electronic Prescription Database. What you're doing is selecting from that list that other people take care of for.
Okay.
And so that's a managed list that you just select from.
All right.
Thank you. Well, we're a little after 7. Do we have any last questions before we finish up? Seth, it looks like you've unmuted yourself. Dr. Prohaska, you have a question?
You okay? Yeah, can you hear me okay?
Yeah, go ahead.
We have a small group practice. So we have 3 doctors. Each of the 3 doctors goes to at least 2 locations. So right now we're spending nothing to call or print out prescriptions and but the big expense for us would be do we need to pay if we sign up for iCoreRX $45 per provider per location?
Good question. So it's group practice, but it's all owned by the group, all the locations?
We're co-owned by the doctors.
Okay, and do you run the same software?
We all run the same software. It's not a cloudware. It is each location is a server.
Okay, yeah, and you're all within the state of Kansas?
Yes.
One subscription each doctor.
Okay, fantastic.
Now, let me ask you one more question. Do you have multiple servers, or are you running that all in one?
We have multiple servers.
Yeah,
Yeah.
So, depending on who the competitors you're looking at, that might mean more, but with us, it's one per doctor.
With you, it's one per doctor. Okay.
Right.
So our cost would be the per month cost plus an onboarding fee, which can vary.
That's right, but ours is 0.
Okay. Very good.
You're welcome.
Thank you.
Anyone else?
Yeah, I had one final question. Kind of dealing. Can you hear me?
Yeah, go ahead.
Okay. Well, yeah, I had a question that made me. Well, I had this idea in my head before, but when the other doctor was talking, before, like, you could call it in, you could fax it, you could email it or write it and all that stuff, and it didn't cost you anything. Is this cost simply because you're having essentially computer companies or IT companies having to manage and create this platform? Like, why isn't it, or at some point, why isn't the pharmacy industry themselves like a provider of this, in a sense? Like, why is it something that is costing us as providers money in order to prescribe prescriptions where it didn't cost us before?
Well,
You still had to buy pads.
yeah, well, and I was going to say like that. The premise.
No, I know what you mean. I'm just being.
The premise is like it doesn't cost anything, where time and pads and things like that does. And the other side of that, there is truth in that. This is a national network of technology that's got a lot of data that a lot of people are working to keep up to date, and that whether it be the drug codes, the pharmacy list, and some of these other clinical tools that are built within it. So certainly there is a cost to that, and and that's part of the cost to it. But what you'll find is if you look, and we put up a quote from Dr. Hardesty there, but what he's finding is this is much quicker and faster than he's ever experienced before. So one of the things that we've seen, especially over the last 18 months, you're seeing less patients, right? Because in between, you're cleaning rooms, you're doing all the sanitation, and more revenues are not trending the way we want them. And what everybody needs in practices and in business in general right now is more time. And so these are one of those ways that you can actually you know, you don't realize it, but there is quite a bit of time just waiting on the phone. You know, we call pharmacy and it takes them 12 minutes to pick up, you know, just testing to see what our local pharmacies are doing. So if you eliminate all that, and then you see at the end of the day, there's some time savings there. And if you take that out across a month, you know, it can be pretty significant. And then, of course, you know, we talked about some of the other things, the accuracy of the prescription, the better patient care, they don't have to wait. And there's a lot of benefits here across the board. And, you know, everybody comes in the same way. It's like, I don't want to have to pay any more money, you know, and every time Netflix increases something, the whole country screams, right? So it's ever increasing burden. However, when you're in business, when you get efficiencies from it and maybe make your patients happier, sometimes, you know, you might find that as at least a break even.
Dr. Herzog, looks like you have one last question, and then let's go ahead and wrap up.
Okay, here's the question for you. If we want to do this, what do we got to do to sign up?
Well, there's iCoreConnect.com, or if that's one way, sign up. We do have a landing page for folks that
Yeah,
we
through
can,
our website, you bet we do.
Yeah.
Yeah.
Yeah, that'll bring you right there. And nice, you want to go there, really. I'm sorry, you shouldn't go to iCoreConnect.com. And the reason you want to go there is because that'll automatically tie you into the discounts. So go to the Kansas Dental Association and look for us there. You'll find a landing page. And, you know, I don't have it on our list here. Certainly, we should probably have that link up, but.
Well, that would have been smart if we had done that, wouldn't it have been?
Deal.
Well, hey, we've been pushing that information out,
Okay.
Dr. Herzog and others, and so we'll have an e-news that'll come out on Friday, and I imagine we'll
Yeah.
include that information on that as well.
Yeah, and you know, we're onboarding in your state right now. So there's folks coming in, they're looking at demos, they're contacting and talking to account managers, and we're onboarding some already.
Yeah, very good. All right. Well, with that, hey, thank you very much for your time tonight. For everybody who was on the call, we will go ahead and, oh, wait, hey, Sandra from our office actually has the link provided here in the chat. So you can check that. Way to go, Sandra. So we'll review the list of everybody that participated, get them at a 1-hour CE card here in the next few days. So look for that. We'll email that to you. And we appreciate your time today, learning more about e-prescribing and learning a little bit about iCoreRX. And I'm sure the folks at iCoreRX would be more than happy to give you some more information as we move forward with this. So, hey, thank you, everybody, very much.
Thank you, everyone.
Thanks, David.
You're welcome. Good night.
We're going to go.